ventilators and weaning. And if you don't understand the concept of a pulmonary shunting and compliance, then you're going to struggle a bit. Okay, so pulmonary shunt is basically the pathology which results when the alveoli of the lungs are perfused with blood as normal, but ventilation that supplies air fails to supply the perfused area. So in other words, the ventilation perfusion ratio, that's the ratio of air reaching the alveoli to blood perfusion is 0. So it can't go over that barrier, and that's a big problem. Sorry, I just want to... So shunt is as a mechanism of arterial hypoxemia. Shunt refers to venous blood, but does not participate in the gas exchange before mixing with arterial blood, so-called right to left shunt. Shunts can be intrapulmonary, that's with atelectasis or pneumonia, or it can be in the heart, the intercardial, that's been the arterial septal defect. Patients with shunt have hypoxemia. In patients with shunt, the response to supplementary O2 is abnormal. So you can give them as the highest oxygen that and it will definitely not make any difference in the shunt because it can't mix. It's intrapulmonary and or intercardial as well. Normally, a 1% increase in FiO2 should increase your PO to approximately 7 millimeters of mercury. This is a very nice outcome measure as well that you can use to see if it's really helping. But then you will have to have access to arterial blood gas analysis. In normal patients in the ward, you can't do this. With shunt, each 1% increase in respiratory oxygen will only increase your PO2 minimally. So this is a nice way. And on the arterial blood gases, a lot of times it will show you whether there's a shunt or not as well. So ventilation perfusion ratio, that's the VQ rate. In respiratory physiotherapy, the ventilation perfusion rate is a measurement used to assess the efficiency and adequacy of matching of two variables. So that's ventilation, the air that reaches the alveoli, and then perfusion, the blood that reaches the alveoli. And if that is not correct, then your perfusion and your oxygenation won't be good enough. So the VQ ratio is the ratio between the amount of air getting to the alveoli and the amount of blood sent to the lungs. And so when you're calculating, it's quite easy. So you just take a VQ, so it's your alveoli ventilation, divided by your cardiac output. So your alveoli ventilation will be about 4 liters per minute. It all depends on what the patient gets. And then the cardiac output is 5. And you just divide it, and then you get your VQ perfusion ratio.